What are the long-term side effects of a cesarean section? CS for both mother and a child. And this video is not meant to discourage any mother out there who has undergone a cesarean section or a mother who is willing to go for a cesarean section because of an underlying medical condition. Okay, so we're going to start with a mother. Some mother develop chronic pain, and this could be due to entrapment of the nerves and the damage of the tissues around the incision site. They can have risk of adhesion. Adhesion are scars that are binding to other organ inside your womb after the operation. You can have risk of placenta previa. A placenta previa is where the placenta is low lying close to the cervix, and it can cause about bleeding and sometimes miscarriages and pain during pregnancy. Another thing, they can develop something we call postpartum depression. A postpartum depression and anxieties. Big up to those nurses who are willing to help these mothers and advising them correctly and willingly so that they can fight all these depressions. Number last, they can have risk of total hysterectomy. If you have undergone a cesarean section more than 3 times, you can have risk of total hysterectomy, removal of the uterus. Let's go to a baby. A baby can develop allergies and asthma later on in life. They can develop breathing problems. They can develop something called diabetic type 1 and become obese. Another thing, they can develop CP, cerebral palsy, and this could be due to delayed cesarean section that makes oxygen to deprivate from the brain of the baby supply, and they develop something called cerebral palsy. So there is something called a microbiome. A microbiome comprises of a bacteria, a fungi, and a virus. So when a baby is being born through a normal delivery, they benefit from this microbiome, and it helps them to digest them so that they can fight all this infection when they come out to this space. So when your baby is being born through a cesarean section, they're not going to benefit from this microbiome, and it's going to affect them in one way or the other later on in life. But it doesn't apply to all babies. Okay,